Profit. They turned a profit. Find out who on the August 19th episode of Health Tech Deals.
I just want to say it's a disgrace to Silicon Valley. So that's the exact email I sent to Jeff Tagney when Doximity went public, and they were massively profitable, and everyone else was like losing tons of money. But yes, it's not them we're talking about. It's a health plan.
Park Brothers.
Have you noticed that this very week, Oscar, which said it was going to sell its health plan platform to other health plans to make money, they stopped doing that. Mm-hmm. They were losing too much and they didn't get anywhere. Bright Health says it may go out of business if it can't raise more money. It's losing so much money. And yes,
Little Devoted.
Shelby Livingston reports in Business Insider that she saw some filings and they actually eked out an actual profit last year. Although I think their profit was 6 or 7 million. Didn't they raise 1.5 billion last year?
Yeah, but profit. I don't know what was more surprising this week, that Devoted turned a profit or that Adam Newman got more funding. And from Andreessen, I mean, the world has gone topsy-turvy.
Oh God, Adam Newman. If there was a way that you can fail upwards, that guy. I know. I think the only explanation for Adam Newman's thing is that Andreessen went, oh my God, SoftBank's number one. We can't let them be number one. We have to be number one. And then realize the number one category is how much money you could lose in a court. Oh well.
Somebody, I wish I can recall who, but somebody had a great tweet stream about how this fundraise just shows what's wrong with the misogyny and the lack of diversity in Silicon Valley and with startups. Do you remember whose tweet stream that was? It was really well written.
There were a number of female VCs who commented this. I got to tell you though, I know the problem, because Andreessen, right? He has less hair than me, and Newman's hair is superb. So it's just basically alopecia jealousy. That's what this is all about.
I see. Okay.
That's what it comes down.
That's really what it is. I mean, you could take a couple $100 and buy yourself a toupee. No need to give this idiot more money.
Yeah, someone might suggest that to Andreessen, but they'd probably block him on Twitter. I think I'd blocked on Twitter and all my accounts. All right, so
people to block you on Twitter. You want to go through these deals?
Yeah, we could do that before anyone else blocks me on Twitter. I do have to say the Park Brothers have both got pretty good hair though as well.
Yeah, it might be the key to their success over there. Although Mario's got great hair.
From
Oscar, he's got great hair.
Yeah, maybe hair is overrated in that case.
I don't know.
All right, off we go.
All right. Incredible amount of money for incredible health. $80 million brings our total to 95, valuation at 1.65 billion.
Yeah, so yet another different nurse staffing agency that only raised 15 million before. I've met Imam Bouzid, who's the CEO. She's a British surgeon, somehow running a nurse staffing agency. They do permanent contract staff recruiting. They have a big community of nurses. We're doing incredibly well. 1.65 billion valuation, if that's real, is beyond amazing, because there are 7 or 8 of these big competitors, all of which are equally funded. They can't all last, but who knows?
Maybe they can. Abridge gets 12 million, brings our total up to 27.
Yeah, I used this tool a long time ago when it first came out. It was at that point aimed at patients to record the interaction between you and your doctor, and frankly, it didn't work very well. They've got another 12 million. They raised about the same amount again from the same investors. So I guess it's they're calling it A1 round. I guess it's not a down round. But there's a lot, now that's trying to sell it to doctors directly. There's a lot of competition. Suki, Robin, Nuance, of course, is in that. This is a tough space, but at some point, someone's got to figure out that interaction and make it easy. So maybe. All right.
This is a good one. Interaxxon gets 9 million in a Series C. This is a headband.
Yeah, Ariel Gunn's the CEO. They've been around forever. It's a headband you put on that's supposed to help you with meditation. They sell it for $300. I think they're trying to move to a subscription service. It's, I don't know, that 9 million was probably a down round. My guess is this is a bit of a tough one to do, but they're still a bit in the game.
All right, what about Arine? They get 29 million for medication management analytics.
Yeah, this is an interesting company. I mean, they were one of Rock Health's early guys. this is one of the things where you go and figure out what drugs people are on, and you use their technology to improve the drug addiction. A couple of other people in this space, but they seem to be growing quite fast. They've got some health plans on the go, so good luck to them.
All right, and then Lyle, Dr. Lyle Berkowitz starts a new company, finally comes out of stealth, Keycare. They announced their $24 million raise, and it's a virtual medical group, but you got an interview with him. What did he tell you?
Yeah. So, I mostly me harassing him saying, come on, Lyle, is there really room for yet another different telehealth company?
So, of course there is.
Well, there's only, 87,000 so far. So the trick is, what he's doing is he said, look, the big hospital systems who currently all use Epic, he's starting with Spectrum, the big system in Michigan, but he's obviously got a ton of others. He's actually going to be at the Epic AGM this week, selling to a bunch of the rest. The big hospital systems, right? They're not very good at they're very good at doing inpatient stuff. They're not very good at telehealth, and they don't do like out of hours care. They don't do after hours care. They don't do out of state care. That there's a bunch of simple stuff that they could get rid of while they want to get people into their funnel. So he says, use my group, use Keycare. We're going to be able to expand the funnel for those big systems. We'll put our doctors and NPs and whatever on a system that uses Epic and will directly interact with their EHR. So it doesn't have to be two different systems like some of the, and he claims that a lot of the big systems are very unhappy with a couple of big telehealth vendors who've been selling to providers, but they don't interact well. And he thinks there's some displacement about to happen. No names will be mentioned, but couple of public companies we may have talked about on this show once or twice, he feels are not doing as good as they could, job as good as they could, and that's where he wants to grow. So it's a different play. Hopefully the niche will work for him. Lyle's done.
Got some good investors in there. I mean, and the smart alignment with Epic. I mean, meet the health system where it's at, Lyle. Meet it where it's at.
Smart guy, and don't forget, he's done a lot around the space of telehealth, and obviously with his work at Northwestern, but he also was exec chair of that company HealthFinch, which got sold to Health Catalyst, and that was
he the chief medical officer at MD Live too?
Yeah, he was for a while there, I think, before they sold that to Cigna. But he's been Lyle's been around and about, and been a great sort of buddy, and commented on this system for a while, and not a dumb guy. So there's now 24 minutes, quite a lot of money, but if you could become the after hours, telehealth remote monitoring service business that manages, even a bunch of big health systems, you can see there's been a lot of flow through that, and it'll keep those big dinosaurs alive for a little bit longer, maybe.
Speaking of dinosaurs, if you'd like to harass this one over here on Twitter,
right into that, didn't I?
One of the oldest Twitter accounts out there. You can harass him before he harasses you. He's at Boltyboy. I'm at Jess Tomasa. In probably the last generation of people that learned how to use Twitter before all the other more exciting things came along. And to never miss an episode of these Health Tech Deals shows or any of the other great content from the blog, head on over to thehealthcareblog.com and sign up for our email newsletter, which I don't even know if it goes out anymore, to be really honest.
Out. Yes, it's coming soon.
But sign up and see. Maybe it will.
Sign everything for the drama and excitement. Yes.
When the
next it'll come. There is a production. There is a supply chain production problem in the news.
Clearly.
But that will be sorted out when the semiconductor bill is done, and when the inflation.
Of course. It's COVID delays.
When I get a discount on my fancy Vietnamese electric car, it's all going to be sorted out.
Okay, all of this is in the works. So
all in the works.
All right. Well, we'll talk to you guys soon. See you next time. Bye.